Good evening, good afternoon, good morning. Welcome to our latest High Impact Practices webinar. Supply chain management, investing in the supply chain is critical to achieving family planning goals. This webinar on the High Impact Practices presented by FP 2020 and the Implementing Best Practices Network. My name is Martin Smith. I'll be your moderator for the next hour. I've been privileged to be a contributor to this high impact practice in supply chain management. You'll see my bio in front of you. It's a little known fact that I was working in private sector supply chain and logistics in the earlier part of my career, but I can't claim any of the great achievements that our panelists and all of you out there who work in incredibly tough circumstances in contraceptive supply chain management to the achievements that you've had. I think my greatest achievement in private sector supply chain was delivering 35,000 Buzz Lightyear toys to kids at Christmas. So not quite on the same level, but looking forward to the insights on supply chain management that we'll have with regard to family planning commodities as we move forwards. So I'll move on to the next slide and take you through the agenda for today. So I will give just in a few moments a brief overview of the supply chain management high impact practices brief. We'll then move through in hearing from our great colleague Julia White from RHSC on the visibility aspect of the high impact practice, and particularly the Global Family Planning Visibility and Analytics Network. We'll then move through and hear from Prashant Yadav from CGD on another key aspect of the HIP, the speeding up of the product flow through the supply chain. We're then very, very lucky indeed to have Claudette Diogo from the Ghana Health Service with us to speak about Ghana's critical investments in supply chain management and the impact and the change that has brought. We'll then move into about 15 minutes of questions and answers at around 9:45 a.m. Eastern time, and then I'll close out just to remind us all a bit more about the next steps. Hope that sounds okay, and so I will move then through to the next slide, which is of course to remind you all that this is being recorded. Please do submit your questions at any time in the panel that you'll see on the right-hand side of your navigation. Please visit the fphighImpactPractices.org website. And of course, we have the handouts there. You'll see the handouts tab again within the navigation, both the high impact practices brief available there, as well as a PDF of this presentation today. So we'll move on again. Thank you very much. So what are the high impact practices? Well, I think as many of us are very familiar, they're a set of evidence-based practices that are vetted by experts against specific criteria and are documented in an easy to use format. And those HIPs are intended to really help programs focus their resources for the greatest impact. And this latest supply chain management HIP is one of 20 HIP briefs that you'll be able to see on our website. We'll move on to the next slide. So there are three primary categories, as you can see here. We've circled the enabling environment brief here, systems or structural interventions that address barriers that affect individual ability to access family planning information and services. And these proven or promising high impact practices are agreed and discussed and approved then by the technical advisory group of the HIPs, a set of experts within these practices. The other categories around service delivery and social and behavior change you can see here as well. And so we'll move on and talk specifically about the supply chain management brief that is the subject of today's webinar. So supply chain management, investing in the supply chain is critical to achieving family planning goals. There was an original version of this brief right back in 2012, at the beginning of FP 2020, if you like, but then a significant set of revisions was deemed to be necessary. And so this 2019 version that we are presenting to you today has been developed over the course of the last year or so, was released in the opening months of 2020. And we're very lucky that Julia and Prashant, two of our speakers today, were key authors of the brief, along with Kate Wright, who was with UNFPA, now back with FCDO in the UK, Kevin Pills of USAID, and Jenny Greeney of UNFPA. And what's clear, I think, stockouts of popular contraceptive methods are common and persistent across many countries, and therefore the intention of this brief in setting out the critical need to establish and maintain effective supply chain management, and that being essential to making modern contraception available and thus helping individuals achieve their reproductive goals. So on to the next slide, please. So why is a well-functioning supply chain so important? Well, the continuous availability of a wide range of contraceptive methods is a key factor in supporting individuals' ability to plan and space their pregnancies. Of course, that reliable stock of contraceptives supports voluntary choice, which, as we all know, is a critical element in user satisfaction and method continuation. And thirdly, and very importantly, effective supply chains support women's choice of non-contraceptives and have the potential to meet latent demand for previously unavailable methods. And as we move through to the next slide, I have a figure here to show you, which is very much central to the brief. And this shows the percentage of facilities stocked out across a range of contraceptive methods by method offered on the day of assessment. And you can see a number of countries on the left-hand side here. This is FP 2020's core indicator number 10, the 10th in our suite of 18 core indicators that we measure across all FP 2020 countries. And this was developed, initiated by the Reproductive Health Supplies Coalition in partnership with ourselves and Track 20 and others. And now we have many years of data. We show 4 years of data rather here for the set of countries that we feature. And a review of the supply chain challenges in low and middle income countries concluded that various inefficiencies and bottlenecks across the supply chain really do contribute to significant high stockout rates of modern contraceptives, and establishing and maintaining that effective supply chain management is essential to modern contraceptive availability and thus helps individuals to achieve those reproductive goals. And of course, this work has never been more important than it is now during the times of the COVID pandemic. And I know that within our Q&A section and within the presentations that you'll hear today, we will go into that in a bit more detail. I just, in the next slide, offer a quick zoom in so you can see in a little bit more detail. I was a bit small on the previous slide, but we do now have that wide range of data that's now available, that stockouts of popular contraceptive products are still common and persistent across countries, and that ongoing investment in and progressive improvement of the contraceptive supply chain requires very significant focus for all of us. And so I just have 3 very quick further slides before we'll get into talking a bit further with Julia. So experts agree on 4 intervention areas that need that focus to strengthen the supply chain management for family planning products. Firstly, increasing data visibility and use for continuous improvement. Secondly, to speed up product flow through the supply chain. Thirdly, to professionalize the workforce, to build and support a competent professional supply chain workforce that is capable of meeting the challenges that we've all encountered in the last few months and indeed years. And fourthly, to capitalize on private sector capacity where appropriate. These are the 4 significant intervention areas that are set out in this latest version of the supply chain management high impact practice. I just want to highlight 4 great country examples on my next slide here with regard to each of these. So under the increasing data visibility and use, you'll see in the brief that the Kaduna state of Nigeria reduced stockouts from 30 to 24% through that use of visibility tools. In terms of productivity flow, our colleagues in Mozambique, the fastest growing FP 2020 country, incidentally, in terms of their MCPR growth, increased product availability and decreased their annual costs by this acceleration of product flow. We'll hear a bit more on that from Prashant in a few minutes as well. In terms of professionalization of the workforce, Nepal, through a process of increasing supply chain staffing and HR capacity, decreased stockouts from 8% to less than 2% during the period. There's more on that within the HIP. And then fourthly here on capitalizing on private sector capacity, Senegal reduced stockouts from 80% to 2% through an outsourcing arrangement with the private sector that was particularly impressive. And as I'm going through, please do get those questions moving. We're looking out for them as we go along through the webinar this morning. And I'll move to the next slide, which is actually my final slide, I think. So here again, those of you familiar with the high impact practices briefs will know that implementation tips are a really significant feature. Tips from countries that have done this and done this successfully. We have 10 implementation tips within the supply chain management brief. I just want to highlight 4 of them here. In terms of increased data visibility and usage, we have the countries that have conducted systematic assessments to identify bottlenecks and solutions, as well as a number of countries that have adopted electronic logistics management information systems and have worked towards visibility across their supply chain from the manufacturing side to service delivery points. We have tips around accelerating product flow in terms of the importance of mapping duplication or wastage, as well as optimizing the infrastructure that we have at our disposal. In terms of professionalizing the workforce, the strong leadership being fostered for supply chain and strengthening human resources for supply chain through a systematic, sustainable approach that countries will need to invest in over a period of time. And then here, in terms of capitalizing on the private sector, tips around private sector capacity analysis, looking at supportive policies that encourage that private sector involvement, and then, of course, the need to invest in increasing government capacity for those contracting and oversight arrangements if they are indeed entering into an arrangement with the private sector. Now, all of these interventions and these implementation tips are of critical importance, but as we will explore, I hope, as part of today's session, these interventions and investments, as I said earlier, have proven to be more important than ever, both in terms of what has already contributed to the robust supply chain that has helped to mitigate the effects of COVID-19, but the further investments we all know we need to make to both cope with the continued effects of the pandemic and any further shocks which may come to our supply chain through other such pandemics or other such events in the years that are to come, to protect the hard-won gains that we have as a family planning community. So I'll move on, and I think we're nicely on time here, which is great. And so it's lovely, as I say, to welcome my colleagues, Claudette Odiogo from the Ghana Health Service, Prashant Yadav from the Center for Global Development, and Julia White from the Reproductive Health Supplies Coalition's global van work. And as I move to the next slide, we're going to turn to Julia first of all. As I mentioned, you can see Julia's biography here. Julia is the director for the Global Family Planning Visibility and Analytics Network, the VAN, at our HSC. The VAN was announced on the world stage at the Family Planning Summit in July of 2017 as a key global good, and since that time, Julia and the team have worked tirelessly to make sure that this this approach to visibility has really paid great dividends across our global family planning community. And Julia, as I mentioned, is one of the key authors of this brief, so is very well placed both to speak about the visibility aspect and also about the brief overall. So Julia, great to welcome you with us. I see that you've unmuted yourself. Welcome on behalf of everyone on the webinar. Sincere thanks for being with us, and over to you.
Thank you so much, Martin. I'm really excited to be here today and to share more about the VAN, as Martin was flagging, and the role it plays in improved visibility, and in this case for improved supply chain management and decision making. So the importance of data visibility and use for that continuous improvement is emphasized as a key investment area in the HIP, in the high impact practice. So today I'll share an overview of the vision for the VAN, the reality of where we are today, and how countries are using it to bring to life some of what is discussed and flagged as intervention areas in the HIP. Next slide, please. So the supply chain players for reproductive health commodities comprise what you see here, which is a very complex ecosystem of trading partners that are spread across the globe. You have donors who are procurers, manufacturers, shippers, countries, and countries themselves who also may be procuring as well as making requests for products. So procurers can source from multiple manufacturers using several different freight forwarders, and a central medical store at the country level is likely to receive product through several different inbound supply lanes. And really at every stage of the product's journey through what we see here as the ecosystem, from one of these trading partners to the next, you have different decision makers who are trying to quote unquote see where the commodities are and answer questions like how many products should be produced and for whom, when should they be shipped out, when are they likely to arrive at my doorstep, etc. And insufficient, incorrect, or mislabeled data sends wrong messages through the supply chain, and this is what can result in stockouts, overstocks, expiration, waste, and in our case, ultimately, patients with empty hands. Next. So the Reproductive Health Supplies Coalition is focused on enabling countries to ensure they can access and use affordable, high-quality reproductive health supplies. And since 2004, the coalition and its over 500 members, many of which are ministries of health, have been developing tools and groups to get the right data to answer the important questions that supply chain players ask. Next. And this slide is just showing us about the long history of supply chain visibility. And at us, if you will, click, again, and again, yeah. So there's a whole series of tools that have been put in place and groups over time. And we have the reproductive health interchange that was developed to tell us who had purchased commodities and how much. The PPMR that you see there, which is a procurement planning and monitoring report and talks about country stock levels. The coordinated assistance for reproductive health group and the coordinated supply planning group, both of which previously responded to better proactively prevent in-country stock imbalances using the data from these tools. So historically, we had the people in the process to really tap different data sources. But the ability to do that in a timely way was really constrained by outdated technology, siloed and duplicative processes, and a lack of data standards, as well as growing complexity in the ecosystem that we were looking at. So the question really was asked, what can the coalition and the global community do to respond to the visibility problem? And there were two potential approaches that one could imagine. Next. So there's the trading partners that could establish their own connections with each other, basically everyone connecting to everyone else independently. And here we're talking about, connections to be able to share data with limited visibility between these connections and limited collaborative decision making because it'd be these one-off connections. So procuring countries could connect independently to the same supplier and vice versa multiple times, as you see here. Next, please. The other option is what you see on the right, which is everyone could connect via a robust virtual platform where the supply chain players can see the right data to make the supply chain decisions they need to make together. And this is the vision for the Global Family Planning Van. Next. So countries are really at the heart of the reproductive health supplies ecosystem and thus the van. This is where inbound products from manufacturers and shippers feed into the in-country distribution all the way down to the last mile. And the full supply chain requires this link between the global manufacturers and shippers and the country actors that receive the product and distribute all the way down into the country. Next. So it's easy to start going far down the road of thinking of the van perhaps as just another tool or a technology system and how it can link with your systems. But it's really important to clarify what the van is and is not. So it is not just a technology fix. The technology is more there to really empower what I was saying about the people and the processes who are the ones really moving product physically through the supply chain. So it's important to start with figuring out those people and processes and how they're in place, and then figure out the policies and technology that can support that need. And so the goals of the van were derived to really align to each of this idea of the 4 quadrants that you see in the conceptual framework. As you can see, the goal reads to better aggregate, share, and align country demand data with production, procurement, and funding to avoid stock imbalances and maximize use of the resources for family planning products. So the doing things better is where the technology part comes in. Aggregating is where we need to look at our processes around data management and data flow. Sharing is where policy comes in, especially around how we share our data. And then aligning is where we need to link across how the people in the supply chain work together and what they need to be doing from a workflow standpoint. Next slide. So if that's the vision of the van, the question is, where are we today in terms of implementation? So today we're working with many organizations at a global level as well as in country, as you can see here. And this list of members includes over 140 individual users at this point in time. Next. The van actually went live last year in January 2019 and has become a significant data aggregator. So its power resides in being able to harmonize data descriptions so that we can integrate and aggregate supply chain inventory, order, and shipment data from across many different organizations all in one place. And as you can see in the dashboard that comes from the analytics part of the platform, the current over 100 users across the 16 different organizations can track what you can see here. And if you wouldn't mind clicking 3 times again. Yeah, exactly. So what you can see here are the over 4,000 orders, 5,000 shipments across 135 countries for 31 products. So right away from this dashboard, you get a feel for the volume and value of the product moving through, and those with the appropriate role security can drill down and understand how this plays out in their particular setting. So countries see their data and suppliers see their data. The 4 countries, so Malawi, Nigeria, Ghana, and Ethiopia, that are already kind of early adopters, have integrated the van into their health system strengthening work and are using the platform for their own internal decision making. And starting in January of 2021, we will roll out the next phase to offer all countries currently sharing data membership to the van as basic viewer for free. And so that should cover a very large swath of the FP 2020 countries. Next. So the van has become a key place for the countries I was just talking about who've already integrated it into their systems to have a one-stop visual that tracks planned and incoming shipments against consumption and inventory to really flag product over and under stocks against the supply plan. and they can see the trends over time and against their requests and orders. Next. So I'm just going to quickly talk about a couple of the impacts of the ban in country that we've started to see and hear directly from our colleagues, including Claudette, who is on this call. Just starting here with Malawi, just a couple. In the interest of time, I'll just pick off a couple quickly. The first one really is talking about the ability to use order and shipment tracking from the manufacturer to arrival in Malawi to plan for storage and distribution. So for Cyclone Idai, this is a really good example. The van alerted the Ministry of Health to shipment delays, and they were able to redistribute stock between those who had stock and those who didn't to weather the delay in country. Also really important when it comes to forecasting and quantification. In Malawi, the van flagged over forecasting for implants, and the data was then used to adjust the quantification. And then also requesting rescheduling of shipment delivery. And so they can use this to create tickets that directly alert procurers for the need to either expedite, delay, or cancel something. Next. And in Malawi, it's talking a lot about this collaboration with donors and how this visibility is really cutting down on that level of effort of telephone calls and emails and all these side conversations to just understand how orders and shipments are coming into the country and use that in their coordination meetings, such as your commodity security task force or working groups that you have in country. Next. And then with Ghana, we're working on connection with their social marketing organization partners in country, and this is a pilot we're working on closely in terms of that value driver, as well as connecting to their electronic LMIS system, LMIS. And so that's in discussion that we continue with them beyond sort of the other value drivers we've seen with the other countries. And so for my last slide, just wanting to highlight here a little bit that the van is helping these countries and soon others that will join us, Basic Viewer, to really align data and thus visibility across different entities within the supply chain who carry out different functions, as you can see here in this visual. So I've labeled here the examples that I was just going through against the supply chain cycle. And you can see the boxes where we're flagging sort of where Malawi with the implants on forecasting and supply planning over on the right, and also with Cyclone Idai with dispensing and inventory management. And you see Ghana there also in terms of the SMO work with some of that supply planning work and with the ELMIS connections to inventory. And then you also see on the left, Nigeria with that donor order and shipment collaboration with procurers and with their tracking. And in fact, that order and shipment tracking is something all these countries are benefiting from. And then Ethiopia also moving forward here on the manufacturing side to start to make some of those direct connections to exchange advanced shipping notice information. So I will end with that. If you'll just go to the last slide, please. I'm just really happy to take any questions that may come up at the end. I know we'll go through the whole presentation, but please do share your questions. My information is here as well as the website for any offline conversations that people might like to have. Thank you so much, Martin.
Thank you so much, Julia, and thanks for that diagram at the end of your presentation, which is featured very strongly, courtesy of our HSC in the supply chain management brief, showing the flow of the full supply chain from manufacturer to service delivery point. So great. And so from one author of the report of the HIPS brief to a second, to our great colleague Prashant Yadav from the Center for Global Development. He's a senior fellow there, previously at INSEAD Harvard Medical School, at the Bill and Melinda Gates Foundation. And I think we've all been following the wise words of Prashant over the last few months, not only in terms of the contraceptive supply chain, but the many roles he has turned up in terms of his great scholarship and understanding of the global supply chain, including thinking around the COVID vaccine piece of all of this. So Prashant, it's great to have you with us, and really excited to hear your views on this second intervention element in the HIPS brief around speeding up product flow through the supply chain, which I know is a particular passion of yours. So over to you, Prashant.
Thank you, Martin. Thanks, Julia, and also all the colleagues who have joined us today. It was a great project to work on this high impact practice because many areas which a few of us have worked on and have discussed with colleagues in countries never get a chance to be organized in a systematic manner. So kudos to FP 2020 and the HIP group for doing an update to this supply chain HIP. I want to talk about something which is, like Martin said, close to my heart. When I teach an undergraduate class in supply chain management or in operations management, oftentimes I pose a question to the students that if you were to sit in a box of health products, or even more specifically, if you were to sit in a box of contraceptives, from the time it leaves the factory till the time it's actually given to an end client, what do you think will be happening to you? And I think most people imagine that they'll be moving in a truck, they'll be moving in a plane, they'll be moving on many kinds of last mile transport. But then we have to share the harsh reality with them that for a majority of their time, they are just sitting in a box somewhere in storage, because the speed or the velocity with which things move through the health product supply chain in low and middle income countries, and in particular for FP supply chains, is quite slow. So next slide, please. So at each step in the supply chain, whether it's procurement or quantification or primary or secondary distribution, the speed with which things are moving from one step to another is often of the order of months, sometimes years. And then we all compare family planning supply chains to some very high speed supply chains that bring us things at home in direct to consumer delivery or e-commerce and other channels. And then the comparison always shows us how slow is the speed of the supply chain that we encounter. So we have reasonably strong evidence that shows that moving product at a higher velocity through the system, and for it to move at a higher velocity, it's not just about the truck going from one stage to another more frequently, it's also about having planning cycles which are shorter and more frequent. So that's the first part in this argument about faster flow, speeding up flow, that we need to move things quickly and we need to plan our replenishment cycles more frequently. Next slide, please. And what low flow velocity does is a concept of what I often call as the forecasting trumpet, which means if we are to forecast something for the next day, for the next 10 days, for the month, we put enough sophistication, if we put enough data and the right kinds of people and other competencies, we can generate a precise enough forecast. But when we start expanding the time horizon for our forecast, which is if we say, how much do we need in the next 3 years? How much do we need at a health facility in the next 3 months? Then we start operating on the right side of this curve, where forecast uncertainty and forecast precision is lower. And it is almost like a law of physics, which is no matter how much more effort, time, data you put, if you are going to try to forecast for a much longer time horizon, your forecast is going to be less precise. And if you are delivering to a clinic every day, then the job of the clinic staff is to forecast how much do they need for the next day or the next 24 hours. And that task will always be easier and that forecast will be more precise. So this is the idea that if you increase flow velocity, your forecast precision improves even without having to expend more resources in improving the forecasting algorithm or the tools. So that's what higher velocity in the system does, one key benefit. Next slide, please. But we know, like I said earlier, that the box of contraceptives is usually sitting somewhere in a warehouse most of the journey that it traverses through the supply chain. And in many of the countries, we observe there are 4 or sometimes 5 levels of stock holding. I take one example here, which is seen in quite a few countries. There is a central storage point, there are provincial or state level stores, district level stores, then storage at the health facility, also at health posts, and then community health workers in some cases pick up their stock and keep it in their own storage area for a month, a week, or some period of time like that. So we have multiple studies. The two that we reference in the high impact practice is one from Mozambique and the other one from Zambia, which show that if you have too many levels in the supply chain, if you store inventory at 3 or 4 or 5 levels, the flow of information about orders, requisitions, and the accountability chain in the system, which means if something goes wrong, is it the central store, is it the provincial store, where should we try to fix things? All of those become more diffuse. And that diffuse accountability means we have stock out, and we have a limited basis to say what is the cause of the stock out and how can we quickly fix and resolve it, because it could be at any of the levels in the system. And then the second is a well-known phenomenon in supply chain management, which is called the bullwhip effect, which is for every additional layer in the supply chain where you hold inventory, any small variation in end customer demand starts getting amplified as you go more upstream. So from the end clinic or the end customer all the way up to procurement or to manufacturing, we start seeing these huge peaks and troughs, even if there was a small variation in end client demand. And then it becomes harder to manage these huge swings of ups and downs in supply planning and making sure that there is a systematic way of continuing the frequency of delivery and other things. Next slide, please. So one is that having fewer layers in the system improves accountability, like I said. It enables better flow of information about end customer demand to all levels in the supply chain. But one additional thing which ties back to something that Julia was presenting is that if we have 4 or 5 layers in the supply chain and you are trying to build in an information system that captures what is in stock and what is flowing through each level, that task becomes harder. And if any of those levels are not reporting accurately or have data quality issues, then the ability to learn about the end demand signal in the supply chain gets compromised. And if you have fewer levels, so imagine in an exaggerated scenario, if you were doing a direct delivery from the central warehouse to all the clinics, I'm not saying that it's feasible or should be the approach, but in that scenario, you have full information visibility or the end demand signal from every clinic at the central store. You don't have to worry about having the systems running at each of the levels in between. So the additional benefit of speeding up flow and reducing the number of tiers is that our knowledge of what has been used and consumed is much more current at each level of the supply chain. Otherwise, if the system is only sending requisitions from the facility to the district to the provincial store and so on, then our information is outdated by at least the time period between two successive acquisitions, unless we have a real-time logistics management information system. So that's the other or additional benefit. I will stop there and would welcome your comments, critique, questions, anything else that you would like to add. Back to you, Martin.
Thanks so much, Prashant. And I think really a very vivid description, particularly of ensuring that demand signal is heard and heard clearly. And I know that we'll come back in the Q&A of Prashant to talking about that and the number of layers that are involved in the context of responsiveness to shocks to the system, including the current COVID-19 pandemic. So that's teed things up very well. Please continue to get your questions that are coming in over the course of the next few minutes. But great to turn to Claudette next, and as referenced by Julia, Claudette within the Ghana Health Service, Ghana, a family planning van country. Claudette is really just an excellent supply chain professional who has just such a range of insights for us. And Claudette, we're really excited to hear how Ghana's investment in supply chain management is paying dividends in the context of your family planning program, and also some of your insights, having heard from Julia and Prashant on how these elements of visibility and speeding up product flow and so forth are playing out in the Ghana context. So over to you, Claudette. Thanks, Claudette.
Thank you very much, Martin.
Wonderful, thank you.
Right. So we just want to actually share what Ghana's investment has been with regard to supply chain, bringing to bear all that Prashant and Julia has actually shared, and as well as you, Martin. Well, as a country, we actually put a lot of emphasis or premium on our supply chain management. And actually, this can actually be seen in what our mission statement is in our Health Commodity Supply Master Plan. The mission states that we want to identify and implement key strategic interventions and activities for a robust supply chain that contributes to the achievement of the strategic health sector objective of the universal health coverage. Next. Next. So we have a copy of the Health Commodity Supply Chain Master Plan, which actually the first one was implemented from 2015 to 2020. As we speak now, we are actually working on the next phase from 2020 to 2025. This particular document overarches all supply chain strategies and plans, from which other programs can draw what their strategic plans are for their supply chain. So for the family planning program, we have had to develop our national condom and lubricant strategy, as well as our Ghana costed implementation plan for family planning, of which we have drawn up key strategies and key activities from our health commodity supply chain. We have also put in place what our pillars are from this plan, which includes coordination, innovation, transparency, and sustainability, so that whatever activities and strategies that we put in place, we want to make sure that we do not duplicate efforts, but in all, there is a form of coordination of all actors involved, so that at the end of the day, we can utilize as much as we can to achieve our supply chain objective. We ask ourselves, is it innovative enough? Are we putting into place latest strengths of technology in order to make things visible and to make it transparent enough for all supply chain actors to appreciate and then to actually guide them decision making? You would all agree with me that we do not have funds that are lying there. So whatever strategies that we put in place, we want to make sure that it's sustainable. It's not that today it is available, then tomorrow or the next year, we cannot put it away and say it is not working. So whatever we actually put together in our supply chain planning, we make sure that these pillars are actually put into perspective, so that we can be able to achieve what our family planning goals are. Next. Now, What is the family planning goal for Ghana or the Ghana Health Service? Our family planning goal is to make sure that we assist all our couples and individuals of all stages to be able to achieve what their reproductive goals and actually improve on their reproductive health. There are various objectives that actually try to speak to the goal. But a major objective here is to make sure that we are providing safe and effective contraceptive methods that are affordable, available, and accessible to all clients at any time as they actually want it. That is the family planning goal for Ghana as we speak now. Next. So as a country, we have actually invested on a number of interventions. One of such interventions is the forecasting and supply planning activity, which we actually carry out every year. This particular exercise is made up of the national classification team, which involves or includes logistic officers that come from government, our social marketing and family planning NGOs, so that at the end of the day, we have the perspective of all family planning actors in the country making inputs where necessary for quantification, which actually goes ahead to produce the supply plans. After the exercise is done, we are able to have supply plans, which actually helps us and guides us in our funding efforts, which is aimed to make sure that commodities are arriving on time, in their right quantities, at the right time, so that at the end of the day, we do not have any form of stockouts or overstock to cause expiry in our supply chain pipeline. Next, another investment that we put in place as a country is to make sure that we are having good coordination. Without good coordination, we believe that we will not be able to enjoy what we are enjoying as a country as we speak now. We have the Interagency Coordinating Committee on Contraceptive Security, which is made up of our donor partners. We have our Food and Drugs Authority there, our social marketing organizations also being part of it, and then all our partners in the sexual reproductive health arena, which includes our NGOs, our civil society organizations, and the Ghana Health Service. So what does this Interagency Coordinating Committee on Contraceptive Security do? These stakeholders actually take key decisions to actually enhance family planning commodity availability, because at every meeting we try to share and provide visibility into family planning stocks at all levels, so that at the end of the day, key decisions are made to ensure that there is commodity security. Next. We have made some investments and continue to make some investments with regards to warehousing and distribution, because at the end of the day, if our warehousing is intact, then we are sure that commodities that are stored there are up to world standards and are effective. Presently, we have 2 central level warehouses as well as 10 regional medical stores that are housing our family planning commodities in country. These commodities do not just stay there. We have our bi-monthly scheduled delivery, which actually moves our commodities from the central level to the regional level, which our last mile distribution also helps in ensuring that the commodities are reaching the clients at the last level of provision through the last mile distribution, which also happens from the regional medical stores to our last mile or our last facility. Next. We have made some investments and continue to make some investments in order to provide some good data visibility, which we call end-to-end visibility. Just like what Julia has actually taken us through with the GSP van. Initially, Ghana was reporting on what we call the PPMR, which Julia showed, which is a procurement planning and monitoring report, which we're doing every month. And we actually have transitioned to the GFP van since January. And what we have been doing is that we go ahead to report our inventory or stock status data and supply plans, which helps us to be able to make interventions worldwide as soon as we can. Because as Julia said, we have all partners on there, from manufacturers to donor partners to development partners, as well as other supply chain actors, in order to make interventions that are really timely. We are also pleased to share with the community that presently we have actually developed our electronic logistics management information system, which we call GELMIS, which actually goes ahead to provide real-time data on our logistics management, which can be really appreciated to make decisions with evidence. We have our district health information management system, which we call DIMS, which goes ahead to have our service providers input data of the services they have actually provided over the period, so that at just a click of a button from the national level, we can see what services they have provided, what the numbers look like, and then we can make key decisions. We also put a lot of premium on our monthly stock status report that shows us or gives us visibility as to what the stock status are, so that if we need to do any form of redistribution, we quickly do it, and then we make sure that we are just on top of the game, so that we do not have overstocks at some point or understocks at some other point, so that we prevent any form of expiries due to overstocks. And then where there are stockouts, we make sure that they have received enough stocks to be able to provide services. Yes, so at the end of it all, in order to ensure this, we make sure that we are on top, and then family planning supply chain actors receive enough data for decision making. Next. In all of this, if we do not invest into the knowledge and the know-how or capacity of our supply chain practitioners, we will realize that we will still not be able to appreciate or improve our supply chain management. So as a country, we have had some form of periodic orientation and training of our quantification teammates, just to make sure that they are abreast of latest trends in supply chain. In Ghana, we have what we call the regional resource trainers, who are found in all the regions. These trainers go ahead, or they are the trainers that train our service providers in all family planning methods. We make sure that we have trained them in logistics management, so that in any training that they have, they'll be able to pass on information on logistics to the service providers that are participants for each training. We also provide we have also provided, and we continue to provide some form of training for our commodity managers at the lowest level in inventory management and logistics, all in the bid to make sure that they have been abreast with latest trends, and they will be able to improve on their stock management and supply chain management as well. Thank you. Yeah.
Thanks.
So all in all, as a country, we believe that where there is no commodity, we will not be able to have any family planning program happening, and will not be able to achieve our family planning goals as there is. So the slogan guides us: no commodity, no program. Thank you very much for your audience.
Thanks a million, Claudette. Excellent. And I'm just going to keep you with us, Claudette, because the questions have come in thick and fast, and I've got two immediately to come to you, and then I've got one or two we'll squeeze in for Julia and Prashant as well. So Claudette, a couple of quick questions here. From our colleague Kristen Seymour, I'm interested in hearing about private sector capacity building in Ghana with the zipline SRH. Be good to hear any views you have there. And then a second question for you, Claudette, from Alicia. Why has Ghana developed a national strategy for condoms that's somewhat separate from other health commodities? Is that because it's a self-care commodity? If so, are there lessons to be learned around that approach in terms of other self-care commodities such as DMPASC? So if you can answer quite quickly, Claudette, because we're running out of time on those two quick questions. Thank you.
So as much as possible, because we actually work in relation to the private sector through social marketing organizations like Mariscope, like DKT and all that, they have these private facilities that they also work with. So at the end of the day, when we develop these strategies and training materials together, then they go ahead and use that funding to support. Sometimes when government is having some form of training, we co-opt some of the private sector to be part of it. That's what we actually do to actually improve private sector capacity. Yeah. And,
thanks. The condom question very quickly. The separate national strategy for condoms. The rationale for that. You hearing me, Claudette? Well, yeah.
Can you hear me? Yeah. So the rationale for having the two separate documents was the fact that because because condom actually provide a dual purpose, there was a need to make sure that we actually zoom right into the condom programming as well as the lubricants programming, so that it will be an adjunct to the concept implementation plan, so that we actually use both to actually work together in order to achieve our supply chain management. So more or less, we actually see each other.
Great. Thank you very much, Claudette. And I'm going to fire off a question to Julia next, which is this from Sebastiana Etzo. Julia, is there a risk in the van of hiding, marginalizing local manufacturers such as those in Africa that are up and coming, but are perhaps struggling to gain a foothold in the business for SRH commodities? Julia.
Thanks so much, Sebastiana. Great question. I think the heart of the van is this idea of collaboration and visibility, and so the more manufacturers, the better. And so I think as we go into countries and understand from them and their system strengthening who they're working with and the manufacturers they work with and opportunities, there's no reason why there can't be, multiple connections. The point is this type of platform should be able to work with many different entities, and then if those manufacturers have the interest and willingness to share data and be part of the network, there's no reason that they can't.
Thanks so much, Julia. And over to you, Prashant. Just a very quick question in terms of if you, this is from our colleague Chandra. What, in your opinion, Prashant, is the key supply chain performance indicator? If you were to select one, and we heard about the box analogy, which was very telling, and the demand signals, what would you choose, Prashant, as a key supply chain performance indicator?
Yeah, thanks. First question, I think I'm not sure we should be looking for one indicator alone, right? I mean, we do have the ability to think about two or three. We do have service level indicators, and I think we've traditionally measured service level using just stock outs. I think we need to expand that and measure service level with a slightly more multi-dimensional measure of service. The indicator that's used in some of the current service level surveys is probably a good one. It's been used in surveys. We just need to systemize that and get that indicator not through surveys, but through routine data. Yep. Second thing I want to mention is that we, some of the indicators that we talk about are usually part of a hierarchy of indicators, right? So some could be just the top level, and then we can drill down and have secondary level, and so on.
Thanks. Thanks so much, Prashant. So great questions. Sorry we didn't quite get to all of them. We'll attempt to pick a few of them up after the webinar for sure and follow up with you. So as we move on, we're just a minute over time. Apologies for that. It was a very rich webinar. I'd like to thank our three great presenters, to thank Claudette and Prashant and to Julia very much indeed. The presentation recording is available, of course, as per the previous slide. And for more information, please do go to FP High Impact Practices, the IBP network, and to FP 2020. My great thanks to my colleague Ados May from IBP, my colleague Laura Rainey from FP 2020 for their great help and support in this webinar. Thank you so much to all of you for attending, and I wish you a very good rest of your Thursday. Take care. Goodbye.
Goodbye.